In April 2010, the President of Sierra Leone, His Excellency Dr. Ernest Bai Koroma, launched the Freeh Health Care Initiative. Now children under 5, pregnant women and breastfeeding mothers can seek medical care and much-needed medicines without worrying about the costs.
First, the time we reflect, I not been there. Tim be the mona, well, out come because one, where the born picky, if you sick now, you not get money. Remember, I will take a picky go to an hospital. But right now, if you are so, as you see, you remember say picking body door and they watch for kind of hospital because you know say then they give medicine the free, then they talk to you back you come right there for go monitor your picking.
Recognizing the high child mortality rates in the country, the President took a bold step to introduce the Freeh Health Care Initiative. Basically meaning that every child and every mother would have access to free drugs, which would be available for them as well, because in the past there were hardly any medicines in the country. To avoid any delay, UNICEF was asked to take on the responsibility of the procurement of all the drugs and then also the shipping, clearing and forwarding to the over 1,200 clinics and hospitals in the country.
Since 2010, UNICEF has procured and distributed drugs and medical supplies worth over $30 million. This would not have been possible without the continuing support of the European Union.
The European Union supports the implementation of the Millennium Development Goals right across the world, and in this context has developed an alliance with UNICEF to fund a program in Sierra Leone which will improve healthcare access through better distribution and supplies of medicines and through the training of health workers. It's expected that this program, which has a funding of 23 million euros, will save many lives in Sierra Leone.
The medicines are procured through the UNICEF Supply Division in Copenhagen and begin their journey to Freetown by sea. The containers are offloaded at Port Queen Elizabeth II in Freetown, where they wait for clearing. Once the containers are authorized to leave the port, they are loaded onto trucks which bring them through the busy streets of Freetown to the central medical stores. Here, the containers are opened in the presence of all stakeholders, including police and civil society. Medicines are counted and inventories are processed into a database to ensure that any discrepancies would be detected immediately. The supplies include life-saving medicines like treatment for malaria, HIV retroviral drugs, antibiotics, and therapeutic food for malnourished children, as well as basics like ibuprofen, syringes, bandages, and mosquito nets. The medicines are sorted and repacked according to the needs of Sierra Leone's different districts. Then, trucks transport them to all 13 district medical stores across the country. The medicines are distributed to all district hospitals and to over 1,200 smaller health centres across Sierra Leone. Many locations require four-wheel drive vehicles or motorbikes to access. No matter how difficult it is to access a health centre, UNICEF ensures that the medicines reach them safely and in time. At this health centre in Mangay Loco village, about 200 kilometres from Freetown, expecting mothers and those with small children are waiting at the clinic for treatment. Many have contracted malaria, one of the biggest killer diseases in the country, and especially dangerous for young children and pregnant women. If detected in time, the disease is easily treated with the correct medication. The Freeh Health Care Initiative, supported by the European Union through UNICEF, has already saved thousands of lives across Sierra Leone. During the first 6 months, access to health services had increased from 25% to around 75%. More women are delivering their children in health centres, and many more are bringing their children to medical centres when they are sick.
As you can see, nobody is paying any money again to doctors. Now that's why people are using the opportunity of coming to the hospital. And they are now coming in. Antenatal clinics are always packed in the morning hours. And you realize that the service again has been improved, the quality of service given, because doctors have been also motivated by increasing their salaries. So everybody is now happy to do all the functions as it is.
The Freeh Healthcare is just the start of the restructuring of healthcare in Sierra Leone. There's a lot that has happened. We have had great achievements in the amount of infrastructural development that we have had. We have had great developments in the drug supply chain management. We have had great development in the amount of health workers we have put in the system, even though we need more, especially at the top level. But these are the success stories we have had as a result of initiating the Freeh Health Care Initiative. And we hope as a government and as a people working in close partnership with our development partners will make great progress. We are looking at putting the structures in place that as a government will be able to stand tall and be able to support our operations over time. But for now, in the short to medium term, we see UNICEF assisting us through this process and even through the transition phase to the National Pharmaceutical Procurement Unit.
UNICEF, in partnership with the European Union, will continue to support the government of Sierra Leone in ensuring the Freeh Health Care Initiative can continue, and so that in the future, mothers in Sierra Leone can be sure their children will reach their 5th birthday.